Okay, well, why don't we go ahead and get started? Good morning, everyone. I'm glad that we have so many people joining today. I put together the cohort 1 and cohort 2 as a group, and NanaEfua is the CEO of Shared Harvest. She was in the first cohort for FBA, and is also an emergency room physician over at Dwight Memorial and Kaiser Hospital in Downey. And we were chatting the other day, and she thought, it might be a great opportunity to get the two cohorts together and make sure that we have an antidote to some of the disinformation that's out there. We're assuming that you're probably already pretty well informed on what's going on, but Nana was really interested in making sure that we broke through some of the myths. I'll be recording this session. Everyone is on mute for the time being. If you have any questions, please just use the chat box, and I'll manage that for Nana. And if it looks like there's something that comes up, I'll interrupt her. The format will probably be about 7 to 8 minutes of information and slides, and then really we'll spend the remaining time answering questions that you guys might have. So. Nana, please meet cohort 1 and cohort 2.
Woo! Yeah, cohort 1. Woo! As you guys probably have, those in cohort 1 already know my personality and my energy, and those in cohort 2, woo woo, you're gonna meet it. And I like to start off because, one of the things about crisis, and I've, been a for now 11 years, and no, don't date me. I was a Doogie Howser-ish. But the reason why I think I gravitated to it the most is where everybody is in chaos is when I work the best to focus. But one of the things that is an important trait in emergency medicine is not to take yourself or the situation too seriously, but you run with cautious optimism. And I wanted to give us a chance to just take some nice deep breaths and remind ourselves where we're at and where we at right now, just being in the moment and not being worried about what's happening 10 minutes from now, a day from now, but just kind of enjoying it and appreciating where we are in the moment. So I love to always start my talks with that and just take a 10 seconds of deep breaths and just appreciate the breath that you are in the moment. So I'll just walk us through it. Just relax. Don't have to adjust your screen. Close your eyes as if you want to. Take another nice, solid, deep breath the way you want to and the pace that you want to do it. And then we're gonna do the last third one, nice deep breath, but then we're all gonna say woosha at the end. 1, 2, 3, woosha. Cool. So today I'm going to be very informal and give you some very important facts about COVID-19, how to prepare yourself, what you really need to know, and then have an opportunity to bust any myths that you've heard, and especially important myths that we here on the front lines that we want to dispel immediately. And then just give you guys an opportunity just to ask me anything and everything, as well as tell you more about what Shared Harvest is doing with a new initiative called myCovidMD.org, and I will talk about that in a little bit. But first I wanted to share my screen to just put in context what we're dealing with today and this country and the world right now. Let's see. Move this here. So let's start with the WHO numbers. I want to make sure you're equipped with all the right websites about where to get the real facts. There's going to be a lot of information out there. All of us are self-distancing, and are in our houses, on our computers. And a lot of these websites look normal, like they're reliable information, but I just want you to have in your arsenal 3 important websites that you should follow. One is the WHO website, which is this one, and it looks like this. So anyone that says they put WHO, doesn't look like this, that's not the website. This information on the WHO is real-time data that gets updated all the time. It also has real-time information about strategic planning. So when you start thinking that there's a heightened level of alarm that is different than it was yesterday, this is a good place to find out how we manage it. And the reason why WHO is really important is because in WHO, it manages emergency response globally. And in the US, we are not very much accustomed to doing that. The second site, and you see 332,000 cases confirmed worldwide. So context is very important. If you go to the CDC, which is nationally, so the CDC Center of Disease Control and Prevention, that's where we house all of our information in the US. You will get all the things you need to know. And if you're doing workshops or you're talking to your constituents and your businesses and you want to just pass out pamphlets, there are PDF versions of everything you need to know. All the facts here, everything is reliable, everything is free on this site, okay? So this, the CDC website, you wanna get familiar with it. There's a lot of great information. This is what the homepage gives you information about symptoms, how to deal with older adults, how to deal with children, protecting yourself, and then the news feeds out here as well. So that's the second one. The third one is what we are focused on. Well, I won't put that one on because that little, I don't know how to move this tab screen. Do you know how to move this, Todd, the bar with the video, the microphone and all of that out of the way?
The very top? I don't know. Oh, there you go.
Oh, is it? Okay. So this is Los Angeles Times. And again, I wanted to share this for context. So there's 300 million Americans, and we have 1,800 confirmed cases. We are just now testing. I'm sorry, in California. In the US, 33,000, okay? Globally, 330,000 about. When we're talking about the curve, so imagine what is happening right now is that with COVID-19, we learned much about it back in September, and then the growing information to the general public really started festering in November. And then it wasn't until early March did we start testing. So we are behind the 8 ball for a long time. And so imagine when you start a slow riding bell curve and you start late, all your face, it's almost like starting a marathon and you know in the middle of the marathon there's going to be a hill, and then you versus starting a marathon at the hill, everything seems insurmountable when you start late, but the hill and the course is still the same. And so this is why this understanding where we're going and where the disease where we're going and how the heightened level alarm has taken is because we missed a large amount of that time looking at what the cases are and what we're doing. But in reality, when you see the hardcore numbers, you see the numbers, and I keep emphasizing this because I want people to be less alarmed in their homes. So this is why it's less important of a stress in terms of the actual vaccine, actual illness itself, actual COVID-19. Now, what does that mean to what we're fighting against and what it is? So COVID-19 is one of 7 classes of coronaviruses. We know a lot of information as scientists about coronaviruses. The interesting thing about coronavirus 7, which is COVID-19, is that it went from mammals to humans. It jumped itself from mammals to humans and then to a human. So it's almost like seeing your 4-year-old all of a sudden do a breakdance and you're like, whoa, I didn't know you could do that, right? And so because of that, the science world is very shocked. Like, is this a different virus? Are we talking about something like HIV? And is it going to do something much more complicated that we're not prepared for? And so that becomes a concern of an alarm in the science world. But just like the analogy I gave you about your 4-year-old, it's still your 4-year-old. So like what we know in the class of coronaviruses, it's still presenting like the common cold of coronaviruses. So that's why the symptoms that we talk about is important. When we talk about fever, shortness of breath, or cough, these are things that are very similar to your typical common flu-like illnesses. And so that's why that's why we emphasize that. Now, what does that mean to people who get exposed to it? Just like the common illness, just like the flu, if you're older, if you already have respiratory symptoms, or if you have immunocompromised states, getting through any illness is going to be a challenge for you. But in particularly respiratory illnesses will be a challenge to you. So in our population of patients, the patients that we are most concerned about are the asthmatic patients, are the patients who are on ventilators, are the patients who have COPD, congestive heart failure, or what is it? I'm using acronyms like medicine. COPD means when there's a class of people who smoke a lot or have a history of just bad lung tissue, and as a result of that, have difficulty bringing in and expelling air in different ways. And so those individuals, air, certain irritants, anything can really trigger their ability to feel short of breath. And so we are worried about those populations. Same way our asthma patients. And unlike what they're saying about COVID-19 being more of the older population versus the younger, in asthmatics, we are seeing illnesses associated with asthmatics who are younger. So that's something that does not get talked about enough. The other thing to know about, once you get the illness, just like the common cold or flu, your immune system can fight it. It is a virus, or as Cardi B would say, virus. But it is a virus, and that's different from a bacteria infection. And the way I like to explain this to my patients is, if you imagine a bacteria and a virus sitting on a surfboard, and one person's on a surfboard that weighs 80 pounds, and another person's on a surfboard that weighs 180 pounds, right? So the person that weighs 80 pounds may be able to surf and pass through the waves and a lot more seamlessly than someone who weighs more. So bacteria weighs more. So when it's surfing through your bloodstream, it doesn't get very far. It gets to your lungs and it causes you to have a pneumonia. It may get to your gastrointestinal tract and cause you to have gastric symptoms like diarrhea, but you won't have pneumonia and diarrhea. Now, with the virus, because it's lighter, it surfs around your bloodstreams, and we call the term hapten, and they cause havoc everywhere. So that's why you get these constellation of symptoms. So you can get fever that's mounted up because your immune response is like, what is going on? Something came to attack me. So it's like an alarm clock in your body. That's what the fever is. And then you have the coughing. Then you have the shortness of breath. Then some people have abdominal pain. Some people still have diarrhea. Some people have muscle aches and bone aches. The same thing with influenza, because that virus is surfing through your bloodstream. And the only way it comes out of the bloodstream is through your urine. So the only way you make urine is you bring in a lot of fluids and you overhydrate yourself so you can take out the viral particles come out the urine. So when we think about, when you're sitting at home and you're thinking about, do I have COVID-19 or do I have the flu or do I have nothing? You're not going to know the difference between COVID-19 and any other viral illness. You will not be able to assess that at home. And what you will be able to assess is whether or not this may be a bacteria issue that you have versus not, if you're very sophisticated. But the most important thing is you need to know that if you're having multiple symptoms, then you're likely having a viral illness. And so then your goal is not to go jump for antibiotics or the next hot thing that people are saying, or but to fluid and hydrate yourself as best as possible so you can get rid of the virus out of your body. But it's at the point where you are not able to drink, when you start vomiting, or the point where you're too weak to even get up and get something, or with our older patients who live alone that they aren't able to hydrate very well. Those are the people we want to see in the emergency room because they need our support, and we call supportive care. They need our support to get them to a place where they are well hydrated and removing the virus out of their body. So that's what you need to know about it and how to protect yourself. Again, the coronavirus has been told right now that we know for sure, based on the family story and the family history, that coronaviruses are actually droplet transmitted. There's been several anecdotal studies that say that, oh, maybe it's airborne. And airborne means like it lives in the air as opposed to it lives in small liquid droplets that again get transferred from person to person. The only thing that has been confirmed is that it can be aerosolized, but it's not airborne. And all that means is if you put something, like if you can shoot something out, it's aerosolized. But for the most part, you have to pass it on from droplet to droplet. So when we put somebody on a nebulizer machine or a humidifier, or in our cases, which is complicated treatment, is something called a BiPAP machine, which we used to be able to do with people who had lung disease, and we can keep them from having to be on a ventilator. That causes, those kinds of machines can cause the virus to be aerosolized and then transmitted at a higher rate. And so when we're talking about what you're hearing, the heightened level alarm in the hospitals, is because of that concern. The only way that we treat people who have really bad lung disease and come with this is we actually preventively intubate them. And intubating means putting them on a breathing tube. And when we preventively intubate somebody, they automatically have to be in the ICU. And if they have to be in the ICU, then we're talking about, do we have the number of ICU beds that can meet the demand that we expect to see? And so that last piece is where you can catch that to what you're hearing in the news about people like, oh, we don't have enough ventilators, we don't have enough ICU. Well, the bottleneck is not there. The bottleneck is at home. How do we help people at home prevent getting to the place where they need hospital care and then potentially ICU care because they're being preventively ventilated? And so my last note before I open it up to myth busting is to remember that just like the flu, just like RSV, which is very common viral infection in young kids, the coronavirus is a community-acquired infection. It's not a hospital-acquired infection. And so because it's a community-acquired infection, we need to approach it from a community-based response. And we'll talk a little bit more about what I mean by that after we open up for Q&A.
Okay, thanks, Nana. We had a question from Pam. Are laundromats a place where the coronavirus can linger for those who have to go out and use public laundry?
Great question. So let me break that apart a little bit. So laundromats are public places that, of the things you share in the laundromats, you share the washer, maybe the dryer, the sitting area, and the bathrooms, you touch things, the knobs. So just like any other place, the question is, how much does the virus exist on a surface? Right now, depending on the surface, on average, the virus can sit for about 24 hours on a surface, depending on the surface. Most of them are like 2 to 3 hours. So if you're wiping down with regular sanitation, which perfectly works to kill off the virus, you eliminate your chances of exposure. So one of those key factors is we say keep calm, wash your hands, because if you're washing your hands and you're not touching your face, you've already eliminated a lot your risk by at least 70%. The next part of that question is if you're putting your clothes in the washer and then using it, and potentially somebody had their clothes in the washer, could that cause you to have it? Well, the goal is that you're washing your clothes. So technically, no. If you had a good soap in there and put it out, that should be okay. So what I would say that laundromats aren't different from any other public place in terms of your basic precautionary measures, which is keep calm, wash your hands, and keep yourself at a appropriate distance of 5 to 6 feet apart for self-distancing.
Great. Louise, I saw a question from you, but before we move on to that, I just did have one question on that topic. Do you know what the viability of the virus is in ultraviolet, like exposed to the sun? Does ultraviolet disinfect, or is it something that is able to withstand a certain amount of sunlight and still remain active?
That's a great question. I don't know exactly the specifics on how long. I do know that there are currently certain, some labs right now that are using UV light to help us kill the virus on our mask. So that has been something that has been told. So yes, ultraviolet can kill the virus. Again, it's a weak virus. There's a lot of things that can kill it. The problem is, and this is why, you know, the science projections are that it's not going to last into the summer, because in the winter season, in the winter months is where we're seeing the flu season. And that's as a result of that, the viruses are much more virulent in this season. But as we hit more warmer summer months, and that's actually much improved in general.
Great. Okay, so Louise asks, should I clean my groceries? Is there a difference if they're shipped to my house?
Great question. So that speaks again, if we break up that question to the shipping material that you brought to your house, will the virus potentially live on that material? Very unlikely. I think the shortest time that it's copper they use is where the least exposure, but even cardboard is something like 4 to 6 hours was the last thing I read. So I would not be worried about packaging from China or boxes being delivered. It's not the box exposure, it's what you do with it and where does it live once it arrives with you. So your groceries within the box, it's like any other grocery, I would wash your groceries. There's always these produce sprays if it's produce or whatnot. But I would exercise just any other regular precaution that you would do to make sure things are sanitary for yourself and just normal hygiene.
Okay, so from Ade, sorry Ade, it looks like I skipped past you here. Are community bike rides safe? Meaning, can a group of people cycle together? Generally, we are at least 3 feet apart. I know that in some parts of Orange County, the sheriff's department they're clamping down and giving people tickets for being too close to each other. Mm-hmm. Something like $100 fine for being too close. But yeah, Nana, what do you think?
You know, and this has been discussed at length. We're not the issue of isolation and quarantine that's happening right now. It's not an issue of whether or not these individual incidental events are causing a problem. It's about movement of people and what are the unexpected or unintended consequences of movement of mass people. So when the difference is, you know, we don't have a public health system we don't have universal health care, that we don't believe healthcare is a human right. We are very much an individual centered health system. And so our treatments and our strategies to health prevention is about the individual, right? When you are in a crisis like this, where you are completely dependent on everyone cooperating at the same level, you're gonna have these pulls because it's a mindset of how you think about prevention. And we have to teach that mindset. And it's very hard to teach that mindset in the midst of an emergency. So I always say this, an analogy like this: if we are in Cuba right now, this is something that everybody has a system in their mind in place to know what to do during a quarantine segment, because you understand your piece in this puzzle. So to answer your question, because you're saying, well, you know, riding my bike is just fine. It's not the riding your bike that is fine. It's the riding your bike and accidentally crashing and falling against 5 other people who were riding their bike, and now somebody is on top of somebody else and sweating and somebody else, and that, you know, consequences that we don't expect to account for is why we don't we don't want to encourage those kind of things. Now, do we encourage people to get out? Absolutely. Do we encourage people to exercise? Absolutely. Because fundamentally, the only thing that's going to kill this virus is building an immune system that is strong enough to survive it, right? So sitting down, eating bonbons and Netflix is not building the best immune system for this. But at the same time, we don't want to, you know, have triathlons right now. You know, it's finding that measured ability to say, this is a short-lived experience that we as a country are going to have to learn how to help each other. And so that's going to involve some sacrifices on the individual side so the greater good can do better and to get through this.
Great. Okay. Anyone else have any questions? They want to ask Nana? Just speaking to that, I mean, the family and I went to a place where we thought we were going to be able to go hiking, and we thought, okay, we're going to be in our car, we'll be in a place where there's not a lot of people, and then you realize, okay, well, I got to go to the bathroom, right? And now you're suddenly someplace else that you weren't before, and you may have potentially contaminated that place if you have it, or you catch it from somebody that already had contaminated it. There are a lot of things that it's very difficult to really predict. You know, circumstance kind of dictates how people interact at times.
Right. Just to speak on that note, so a lot of the reasons, you know, people have been upset, there's been a lot of festivals and gathering events that have been closed down. From an emergency response standpoint, those are very critical, what we call critical nodes to close, because if and from the emergency standpoint, we are preparing for a disaster. Our assumption is that this will be critically bad. And we run with that assumption because we have to prepare the system to absorb that badness. And so, for example, if you have an event where all of a sudden there's a breakout of a blast or something, you know, exploded, or somebody got sick from something totally unrelated to this, but that volume ends up in the hospital setting while you're dealing with the volume of patients who are you're screening from COVID, that's when the capacity of the hospital breaks down. So you have to think about it from that standpoint. It's not the event, it's the consequences if something went wrong at the event. What are we doing to our healthcare system?
So even traveling in your car then, right? Because you get in a multi-car pile up, and then you unnecessarily burden the emergency response system because of that accident.
Exactly.
Okay, well, Nana, I really appreciate you taking the time to do this. As I mentioned before in the notes, I recorded this presentation from Nana, and so I'll be posting it on our Slack channel. So, you know, if you want to share it with your friends, Nana, do you think that would be okay?
Yes, and I just want to get a chance to talk about CovidMD initiative.
Oh yeah, please.
So I'll share this screen. So Shared Harvest Fund, I guess I didn't say a bit about my background. In addition to being an emergency physician, myself and two other emergency physicians founded COVID Shared Harvest Fund, which is a platform designed to elevate the impact of volunteering by offering student debt relief during volunteer work or for people who are doing volunteering. I don't know. Can you see the screen or is not? It's not showing.
No, not showing up.
Let's try it.
There we go.
So what we do, we partner with nonprofits throughout the Los Angeles and Chicago area. It is a national platform, but we consolidated a bit. And nonprofits list the projects that they need to have done. In exchange, we find volunteers who are skills-based volunteers and match them up with those projects. And for every project they do, they earn somewhere between $250 to $1,000 towards their student loans. With the myCovidMD initiative, it's a new app that was developed by our team to offer free telehealth services through our volunteer network of community health partners. And the reason why we chose to do it like this is because you'll see as the emergency system is becoming much more inundated, we want to get that COVID community triaging activated. So we want people to be able to screen themselves before they say, I need to go to ER and screen myself. And doing so it's much easier if you have insurance and you have a medical home. But in our population right now, we are seeing the holes in our safety net in healthcare. And there's a lot of people who use the ER as their primary medical home. And so with this app, it allows anyone to have access to a doctor within 15 minutes, as well as our community health partners are people like us, people like you, that may be social workers, teachers, community organizers, head of startups, who are informed enough about the COVID crisis to be able to help somebody get along, answers basic questions, and then turf them to our team of medical doctors if they need a more deep medical screening. But in addition to that, the most important thing about the quarantine moment is for people not to feel isolated. So the CHP community are involved in these 10-minute video conferences where people can call and just want to connect with somebody, and they are able to connect, talk, and then if you feel someone is in danger, we have a team of mental health therapists who joined that then will call those individuals back within 15 minutes or deploy what we call our home health wellness teams that will go to people's homes or where they are if they're in shelters, just to check in and make sure our communities are okay. The beautiful thing about this has been funded so that any volunteer that's on this platform will get up to $10,000 towards their student loans, or $3,500 towards an emergency savings account that can't be removed until 6 months. But at least we're building a financial health within this emergency response period. So the actual app will be launching live on Friday, but right now, this is a website. You can actually click on the sign up page here, and you can fill out this very quick intake form to tell us who you are. And then one of our team members will contact you when we're live. And all of this is done at in the comfort of your own home. So it's an opportunity to really help and be part of the movement to support each other and support financial health.
Great, Nana. I actually have a couple questions here. One is undocumented people don't really have access to a doctor, and they're not getting a lot of benefits through the relief funds. Is this something that they could take advantage of if they need to?
100%. We need as much help getting the word out that these are exactly the people that we built this platform for. So undocumented, undocumented immigrants, homeless, people who are living in shelters, um, people with disability, especially people who right now, the community are blind, is important because the tactile nature of our world for them is so important, and that has been eliminated in this quarantine period. So those are things that we think about as well. So yes, absolutely.
Okay. Next question is, do you have a crowdfunding platform set up so that if anyone wants to donate,
They can
do you have something like that?
we have not set official crowdfunding, but if you go to the site, there is a donation tab. We're getting a lot of corporate sponsor funds too, but if you click on here, it gets you to our giving website. And I don't know if they've even actually started that one, but this is the site where you would actually, if you wanted to donate as an individual to what we're doing, yes.
Okay. Can you go back to the site really quickly? Because there was a question about what so it's covidmd.org. I'm going to put that in the
And so just like
chat here.
now, there's two parts to it. It's the myCovidMD, and myCovidMD connects you to COVIDMD, COVID Psych, and COVID Well. So once you get a community health person that answers the phone, they will plug you into a doctor. They will plug you into a mental health or behavioral health psychiatrist or therapist. Or if you just want somebody to walk you through meditation and wellness, they'll walk you through a 10-minute wellness meditation service absolutely for free. Then the other side is what we call myCovid-19 Live. And you'll see the button, once this changes, you'll see the button for each one. And that's for organizations, nonprofits, companies, small businesses specifically, who want to set up a webinar like this for their staff. They can do that, and we have a team of people who are ready to do it within 4 hours. So if you're like, this afternoon, it would be nice for my whole team to get together and just get some Q&A done. And it's not it doesn't have to be a formal presentation. It can be just like they're just getting on and they're going to give you 20 minutes of their time to just myth bust with you for that time period. And we can set it up within 4 hours. And that's also a free service that we're offering. And then, it's up, we also obviously accept donations, but all the donations go into the initiative that we have.
Okay, and then I've got one last question. So if anyone wanted to volunteer, I know that you're a volunteer program with a pretty well-developed structure of compensation for people who are working for corporations. But if you wanted to, let's say, I'm at LACI, which is a nonprofit. Could I volunteer to help in any way with Shared Harvest or myCovidMD?
Yeah, so the sign up here is the sign up for volunteers as well as for nonprofits who want to include this. So you can sign up here to volunteer, and on the site, it has a link to our Shared Harvest Sun website. This site has been inundated because everyone's so beautiful. Everyone's always looking for volunteer opportunities now. So this is a Shared Harvest Fund official website, and you can sign up to be what we call our volunteer debt freelancers, and that's where you would sign up, and then there'll be a listing of projects. Right now, most of the projects are COVIDMD related projects or COVID-19 projects that are going on with our nonprofit partners and whatnot. But outside of this period, this would be the site you go to, and we run the volunteer projects like we run a gig economy. So they're gigs, they're not commitments for 2-3 years. It's project by project based initiatives.
Well, Nana, thank you so much for all of this. Does anyone have any questions before we close? I think we've got everyone. Any last minute questions? I posted the web addresses in the chat. If anyone does have any other questions, can they reach out to you via Slack?
Yes, please reach out to Slack, or you can drop us a note on people@sharedharvestfund.org as well. If you
people@sharedharvestfund.org.
And you can follow us on Instagram. We have a dope Instagram site. It's so fun. It's @sharedharvestfund. And on the only thing on Twitter, we're called Ask the Fund. So you can follow us on Twitter as well.
Ask the Fund.
And if we do this right, maybe, you know, this will be the next example of debt cancellation, everyone. So get on board.
That's right. And we want to support you every way we can. Thanks a lot for presenting all this information to everyone at FBA. I'm going to be sharing it with everyone at LACI as well. If there are no more questions, then I think guys, we're good.
Thank you.
Thank you all for attending.
Thank you.
Stay encouraged. This too shall pass. Bye-bye.
Bye, everyone.